Hey everyone, welcome to Natural Health Houston. We wanted to shoot this video today kind of giving you an overview of what to expect on your first appointment with us. We know a lot of people, before they come, they want to check out and see what it's going to be like before they ever see us. So I think this is a good intro just to kind of see what's going on. The other thing I'm going to give you is my 5 things I wish all of my patients would know before they come. So hold on for that at the end of the video. But as just kind of an overview of what we do here, think of this as the flow is very similar to other practitioners that you might see, where you come in, first thing you're going to do is meet our front staff, and they're going to greet you and give you some paperwork to fill out. There also is paperwork online, so you can print that out and fill it out, or even do it digitally and send it to us and email it before your appointment. But after completing the paperwork, what you're going to do is get to go back with one of our 3 doctors, Dr. Wilson, Dr. Mitchell, or myself, Dr. Tyer. We're going to be able to sit down and just give a chance for you to kind of tell us a little bit about what's going on today, what complaints you have, either neck pain, back pain, and kind of give a history of where all of this kind of started. So we do the history to really kind of target what major injuries you have or what areas of complaint. And we really encourage a lot of detail there. We want to know more about it. We're not going to try to rush you through this. We want to spend enough time to adequately address those things. Most of our new patient visits take about 30 minutes to an hour on average. So we're going to be able to really work through those things. Next, after we get through the subjective portion, we move to an exam. So when we're doing exams, we're going to do range of motion, do some orthopedic testing, do muscle strength, deep tendon reflexes, and sensory, just to kind of see how your body is focusing and trying to localize what actual tissues are injured. Is it your muscles? Is it your joints? Is it your nerves? And trying to see how all those kind of things play together with it. So after we complete that section, we're going to give you just a review of everything and give you some differential diagnoses and try to say what we think is most likely going on with you and what the source of the pain and dysfunction is at that time. So sometimes it's easy whenever you're coming in after like a car crash or if you were lifting weights and did something. But other times it may be this repetitive stress trauma that you didn't actually know why it kind of caused that. So we try to give you an approximation of what may have triggered these events too, not just what tissues are actually dysfunctional. So we go over our treatment plan. Treatment plans are going to be individualized to you, and so it may look different for each person or depending on what complaints they have. But it's usually based off of passive therapies like heat, e-stim, ultrasound, laser therapies. We also do soft tissue myofascial work that's kind of similar to massage. And then we do adjustments, which is kind of the bread and butter for chiropractors. What we're doing is we're mobilizing those joints. We're clearing restrictions within those joint segments between different bones to allow and facilitate that motion to kind of reoccur. And the other thing that we always focus on is stretching and exercises. We think that after we kind of get you out of pain and back to where we want to go, we want to start re-strengthening you so that way you're able to function longer in between visits. We're not trying to get you in here for 2 times a week for the rest of your life. We want to get you better and to the point where you're able to maintain this outside of us. Lastly, after all of this, it's a lot of homework, and we want to give you exercises and stretches, like we said, to go out forth and be able to do this and work on things on your own. But come back and see us whenever you do need or have a flare-up. So that's kind of an overview of what the whole treatment plan is, and we really like spending time with our patients and helping them with their injuries and complaints. All right, now, as promised, are 5 things that you need to know before you come into your first visit. Number 1, try to come in as soon as the pain starts. First or second day after you start feeling different or that pain kind of start is really the best time for you to come in because it gives us the best chance of getting you better faster. Usually 2 weeks is too long because you need to, your body starts adapting and you start having kind of some change in your posture and everything else. So we don't want chronic pain to set in. So number 2, clothing. Loose fitting clothing is preferable because we're able to actually stretch you effectively, or if we're doing soft tissue, move it around to be able to expose that area, your neck or your back and that skin. I can't tell you how many times people come in with jeans and they've got a knee complaint, and I'm just looking at them like, I don't know what to do right now. So that's one of those things that make sure it's easy to expose that area for whatever you're having pain with, so that way I can properly address it. Number 3, guys, I'm not scary. I wasn't trained by Rambo. I'm not going to sneak up and snap your neck. That is not what we do here. All of our treatment is based off patient comfort. When we're doing adjustments, we're targeting whatever you need, that tissue very specifically, and we're delivering safe, effective, and patient comfort adjustments or treatment with what we do. Number 4, we treat more than the spine. A lot of people don't realize it. They think about us when they do neck or back injuries, but we also treat ankles, shoulders, knees, hips, elbows, all the times with these muscles and joints and nerve injuries that people don't always think about chiropractors for. Neuropathy, headaches, nutritional consult. We're always working on different things to help you with your complaints. And number 5, probably the most important, is you're going to feel better when you come here. Usually immediately we're getting you out of pain. We are really honed in and trying to get you out of pain so you can get back to your life. And that's really what we focus on, and I think we do a pretty good job with. So I hope this helps you. I can't wait to see you and get to meet you and learn more about what's going on, so that way I can help you have a better day.